Hello, everyone. My name is Abby Wicklein. I am a senior health science major here at Mizzou. I will be graduating in May to pursue a career in medical device sales, and that is why I chose to discuss medical devices and how they affect our healthcare system. So, what is a medical device? A medical device is, according to the Food, Drug, and Cosmetic Act, it is a instrument, apparatus, machine, implant, or other similar component that is used in healthcare. So there's a wide range of medical devices and how they are used. Simple devices include things such as tongue depressors or bedpans, and then can go to even complex technology such as pacemakers and ultrasound machines. So, a medical device is regulated by the FDA and must pass inspections before being used by any medical professional or on any patient. The amount of time that it takes to pass the device depends on the complexity of it. So there are three different classifications of medical devices. The first is the basic devices that have a low risk. So these are things such as gauze or bandages, things that are used by a nurse or a medical professional in their everyday line of work. The second class is going to be a little bit more complex than the first class and has a medium risk. So some examples of these include air purifiers or things such as acupuncture needles. So still common devices, but not used every day maybe. And then the third class is the most complex device and has a high risk. So some examples include implants and defibrillators. So these are going to possibly be keeping a patient alive. So these class 3 are either going to be with like a life-death situation. And then I'm going to tell you a little bit about the history of medical devices. So in 1906, the FDA began as the Food and Drug Administration. So that is when they began regulating foods and products in stores to make sure that they were okay for us to be ingesting. And then in 1976 is when the FDA took over the manufacturing and marketing on the medical devices. So they regulated the commercials that were going out to make sure that everything that we were getting as patients or patrons we were understanding and getting the correct information. And then in 1990, the SMDA, or the Safe Medical Devices Act, was passed to have hospitals report any problems or successes of their medical devices. So the goal of this act was to keep patients safe when using a new medical device. Today, the FDA has made many improvements by regulating medical devices very closely before it enters a hospital and is used on patients. So some positives I'm going to give the positives and the negatives of medical devices, but I will start with the positives. Some medical devices have a lot of positives in the healthcare system today because of all the new technology, and it is keeping patients alive longer. So today there are machines and pacemakers that work better than ever before to keep these patients alive. Excuse me. In the medical journal, down below that you see here, researchers give advice to medical professionals about what to look for in a medical device before using it. So a very popular medical device that almost everyone has is a smartphone. Medical device companies have come up with applications to help understand medication dosage or even send them alerts or reminders of when to take that medication. So diabetics even have a great new way to use their phone to track their blood sugar. And then it can also send alerts on when their blood sugar is low or too high. So this can tell you when they need a snack or when it's time to change it up a little bit. These applications on smartphones make it easy and quick for patients to take care of themselves at all times. So whether they're at home or out and about living their daily lives, they can have these applications to help them. And then medical professionals need to look at how effective the device is and have an understanding of the requirements for new medical devices when looking at them for their practice. So surgeons and doctors need to start finding a balance between innovation and then the safety of the device, because ultimately this leads to the safety of his or her patients. So some of the negatives, in the United States, we're very lucky to have the technology that we do. However, this can lead to more complicated problems, hard to use devices, and more patient complications as well. These innovative new devices coming out on the market are very nice and fix some very large problems quickly and effectively. However, these devices are not always user friendly and are used by medical professionals who have not been properly trained. So this is becoming a massive problem in healthcare that has been addressed recently because of the amount of patient complications. An example of the misuse of medical devices is an article that is down there below, written about an auto injector on the market. So anaphylaxis is life threatening and can be helped with epinephrine through an auto injector. So these auto injectors were given to many patients. Unfortunately, only 22% of these patients with the auto injector knew how to use it correctly, leaving that almost 80%, the majority of these patients not knowing how to use it. So health literacy has become a major problem within our healthcare system because many patients do not understand the medication they are taking, why they're taking it, or what the proper dosage is. So patients are scared to ask questions to their doctor because they feel intimidated by the healthcare professionals, or they feel that they're taking up too much of their time. So lack of health literacy is leading to more frequent or longer visits even in a hospital or a clinic because patients do not understand the care that they need. So it is very important that these new medications and devices being used by patients at home are explained in a simple way or by relating it to something that the patient can understand. So these negatives can easily be fixed if healthcare professionals take a little more time to spend with their patient and make sure that they understand it. So one of my favorite ways is the teach back method. That means that the doctor would be giving the patient information and then asking that patient to relay it, or can you tell me that in your words? And then you can know, have a peace of mind whenever they leave your office that they do know what they have to do to make themselves get better. And then down in this diagram below here, it says that more than 80% of health information provided by the doctor in the office is forgotten by the time patients get home. So that's a huge deal. That's something that we could help with. Doctors could give more handouts, something that the patient has to refer back to whenever they do get. So nurses are a large part of why medical devices have become so successful because the nurses are the ones who are using the devices the most with the patients. So Zhang conducted a systematic review of nurses practicing with medical devices and then their feelings towards them. He found that nurses understand the positive impact that these devices have on patients. However, some of these devices, and they do keep patients out of pain, and others can even keep patients alive, and they understand that they're vital to patient care. However, these new medical devices bring on more stress and paperwork for most nurses. These nurses have found themselves more worried about patient outcomes because they have to put all of their trust into the device that they are using. We all know that technology has problems and can malfunction at any time. This causes nurses to have their guard on more with all patients and has led to more stress overall. So new devices have also led to more paperwork for nurses to administer to the patients and then family. The nurse has to sit down with patients and family to kind of go over why they will use a device and what it will be doing, and to make sure that they are okay with it. Each patient will have to sign off on the usage of that device, and it is taking more time out of the nurse's day to file more paperwork. So instead of that nurse getting that one-on-one time with their patients, they are spending a little more time maybe doing some more administrative work that they may not be as fond of. Okay, so next I will be talking about how medical devices affect the healthcare system and how devices have changed the cost, access, and then the way patients are cared for. So there are pros and cons to all of these factors. Medical devices go through, here we go. So cost is going to be what we're going to talk about first. So medical devices go through a post-approval study, also known as PAS, before hitting the medical market. The cost of these studies are unknown, and researchers have found that they may not be as helpful as they sound. So costs of post-approval studies are funded by the device manufacturer, and for this reason are not exposed to the public. So Wimmer and his team put together a panel of experts on medical devices to get an estimated price of what they believe the average post-approval study costs are. And the study was conducted over an 8-year period, and they found that these studies cost about 1.22 billion over that time, and that was talking about 277 different devices, and then each study had an average cost of about $2.2 million. So it's a very large chunk of money spending on just these post-approval studies before these medical devices hit the market. So the healthcare system is investing a lot of time and money into these devices. Next, I'm going to talk about quality. So devices in healthcare have a huge impact on the quality of care. Most medical professionals' main priority is the quality of care they are giving their patients. So medical devices can provide a better quality of life for some patients and could make the difference of life or death. So for example, if a patient has been permanently paralyzed, a motorized scooter can significantly improve the patient's life by making them mobile and more independent. So as I said before in my previous slide, talking about the history of medical devices, the FDA plays a very large role in medical device production overall. And to ensure the quality of these devices, the FDA has very strict regulations for these products before they are allowed to be used on any patient. After these devices are put on the market, they are continuously regulated to ensure safety and quality of that product. Lastly, in Paniscu's journal, he pointed out that between 1980 and 2000, he quotes that the heart attack mortality decreased by about 40%, the stroke deaths declined by 37%, diabetes complications were 25% fewer, and breast cancer mortality was 20% lower. So all of those numbers right there that I gave you, these health issues are some of the leading causes of death here in the United States, and medical devices have taken the mortality rate of those down tremendously. So all of this information shows that medical devices really do contribute to the quality of care of the patient. Next, I'm going to talk about access. So the access to these medical devices is a touchy subject to some people in the healthcare world. On average, it takes about 13 months for a medical device to be approved in the United States. By approved, I mean approved by the FDA to go on in order to use by a medical professional. So the reason for this is the FDA has to approve the device for safety, effectiveness, and clinical benefit. If the FDA does not think that the device meets that criteria, then they will not allow the device to enter the market for usage. Most devices that do enter the market can be covered by the patient's insurance. So the reason the United States has a slow approval process is because we do not have universal health care. So in comparison to other countries like Europe. So in this article that I cited below, Europe has a universal healthcare system, which means that if they want care, they have access to care. They are given care by their government and can basically have it at any time. In the United States, patients have the right to care. So that means they have the right to and the means to pay for it. That is where it gets a little complicated with how long it takes for our medical devices to be approved by the FDA and get out there on the market. Access for Europeans is much easier because they do not have to jump through all those hoops with insurance or finding a way to pay for that. So next, I'm going to be talking about innovation of medical devices. So innovation of medical devices has become a very big topic in the healthcare world. And obviously technology changes every day, which is great because it has become a very big helpful factor with keeping some patients alive and just getting patients back on their feet. So the way that this touched me personally was I actually have been through two ACL surgical repairs, and I did it the conventional way. So I was taken, it was a bone tendon bone process where they took my patellar tendon, they harvested that tissue, and then they repaired my ACL that way by refusing it to my tibia and my fibula. So a new innovative way that they have found to repair ACLs is called the Bear method, or the bridge enhanced anterior cruciate ligament repair. So basically what they're going to do in this process, I'm going to switch the slide here to show pictures. They take a blood sponge of the patient's blood, and then that would also be called a scaffold, or a scaffolding. They take that basically and go in and refuse the ligament that way. It is less invasive, and it also leads to a shorter recovery time overall. So my recovery time was almost 8 months, where they're finding with this Bear method that it can be as little as 4 months, which is really great. It's getting patients back on their feet faster. It's giving more flexibility and torque in the knee, which is what the main problem is. So very cool method. Without medical device innovation, this wouldn't be possible. So in conclusion, medical devices have a positive impact and affect our healthcare system greatly. This project has given me a better understanding of how medical devices fit into our healthcare system, and it's made me excited to get out into the workforce and start selling them and learning even more about them. So I hope that you enjoyed this video, and thank you so much for watching. My references are right here on this next slide.